everyone. My name is Bella Wolfson, and I am an intern with the Public Policy Center here at the University of Iowa. And today I have Dave Cwiertny, who's going to be talking about his research with water policy and health. First question I have for you today is, could you explain your work and what motivated you to start it?
Well, thanks for having me. I am an environmental chemist by training, and so it's a sort of a unique path that takes you from doing chemistry to, I think, some of the issues we think about now. But I'd say a big driver for the work that we do in the area of water quality is just better trying to understand the factors that lead to environmental pollution of our water resources, and then the risks that that poses to public health, and particularly Iowans. And so we focus a lot on issues in Iowa, and a lot of that means that we're looking at contamination that might be derived from our land use, whether it's agriculture or just older sewer systems and leaky septic systems. And so we've really latched in on issues around private wells. We have about 300,000 Iowans that get their water from private wells. These are water sources that are unregulated by the Safe Drinking Water Act. If you go to the EPA site, it'll tell you that those homeowners or those well users are responsible for the quality of their water. And it presents all sorts of challenges in terms of trying to understand how we can better monitor those water supplies and then provide resources to help people on wells get access to cleaner water if their water is contaminated. I do research in a lab. That's primarily what I was brought to the University of Iowa to do. And we think about pollutants and where they are in the environment and how they degrade. We also try to develop treatment technologies that are at small scale that could potentially help those homeowners or those well users. Think of like a better Brita filter. But then we also really try to focus on making impacts and thinking about state level policy decisions that could help increase access to safe water for people on private wells or in small rural systems that might have capacity limitations. And then really trying to understand the health implications, because really, good policy action is often driven by risks to ecosystem or human health, and primarily human health. And so when you think about drinking water and trying to get better access to clean, reliable, safe drinking water, really has to be a response to where we know where people that are vulnerable from what they're drinking.
How has COVID-19 altered the way that you go about your research or the recommendations that you've come to?
Yeah, that's a great question. It impacted everything that we do. It intersects with all the different aspects of my research program. I have PhD and master students that work in the laboratory, and they've had to change their habits in working in the laboratory. Some of them have changed their research focus. So I mentioned that we try to build a better Brita filter using nanotechnology in my laboratory. And we quickly realized that we could also use a similar filtration technology for personal protective equipment. So thinking about air filter material that you could potentially wear as a mask. And so we have a project going on that is entirely inspired by COVID, and we have support from the National Science Foundation to use the technology that we make in our lab and try to extend it to building better masks that might be able to capture and kill pathogens like the coronavirus. For the work that we do, where we're really trying, so much of the work we do in Iowa is driven by interacting with members of the community, or whether it's people who rely on private wells, or through the center that I direct on campus, the Center for Health Effects of Environmental Contamination, programs where we look at things like lead levels in schools. All of that has changed just because it's so much harder to have that engagement, and you really need meaningful engagement and relationships to get access to people's water supply or access to a building to get water samples. That a lot of that has sort of been put on hold or has to be done differently, sort of respecting public health practices like things like social distancing, and also just understanding that when you're trying to do work where you're helping people that want to know more about their water quality, that now might not be the time where they're really worried about water quality. They might be worried about other things. And so, just figuring out how to have those meaningful engagements while still respecting that this is a difficult time for everybody, and also not putting the challenges that might be there on the back burner and forgetting about them either. We have these public health challenges in the background here in Iowa that and good programs like that help people on well water that we have to make sure get maintained even in these difficult times. So yeah, it's been difficult, but we're doing our best and trying to make sure we're doing the most meaningful and impactful work during COVID.
My last question for you is, how do you expect the post-COVID world to impact your findings?
Well, I do look forward to whenever we get back to the way things used to be, if we ever get all the way back. The post-COVID world projects that we have that are COVID related, I think we've worked hard to make sure that they're relevant even beyond COVID. So when we think about making personal protective equipment for frontline workers during COVID, we've long wanted to extend the materials we make for water treatment to air when we think about people who work in concentrated animal feeding operations and trying to minimize the exposures they might get while working near animals or with animal waste. So, I think that there will be ways in which the things that we've developed or done entirely in response to COVID is maintained and finds new ways to continue to grow. For the changes in how we do some work with regard to engaging communities and thinking about how we can, still maintain presence in monitoring water and finding water solutions, even when communities and other partners might be less willing to work with us. I think we'll be able to restore a lot of those connections. And I do think that we'll probably come out a little bit better, in terms of ways in which we can still do the work we need to do without having to be disruptive. We may not need to go into a home to get a water sample. Maybe we can learn a lot just by looking at water outside the home to get an initial assessment of where our priorities need to be. So, we will adjust when you're working on issues like we try to work on that link the water quality and water pollution to those human endpoints. You need those relationships. And so we'll have to rebuild those and reconnect on those once we get the opportunity and it's safe to do so.
All right, thank you everyone for tuning in. That was Dave Cwiertny talking about water policy and health. And I'm Bella Wolfson, an intern for the University of Iowa's Public Policy Center. Thank you.